quiz 2 about the gluteal region of the thigh, and this quiz contains 5 questions. I will discuss question by question. Meanwhile, you can attempt to answer. First question: following are the actions of the gluteus maximus muscle. If you can remember the actions, gluteus maximus muscle actually perform the combination of lateral rotation and extension at the hip joint. And also it supports the extension of knee joint through the iliotibial tract, because one place this muscle inserts is to the iliotibial tract. And it also a major extensor at hip joint when the extreme hip movement performed, such as in running, climbing stairs. In those instances, this muscle plays as an extensor of the hip joint. But in other instances like quiet walking, when the hip is in mid position, it does not elicit a significant function. But in this instance where the quiet walking happens, the hamstrings are the muscle come into play and function as main extensors. And during the act of sitting down from standing, again the chief anti-gravity muscle is also the gluteus maximus. Alright, so we'll go through the answers. Answer A, flexion of the hip, it's false because it acts as the extensor of the hip joint. Lateral rotation of the hip is true and supports the extended knee, true, via the iliotibial tract. Answer D, main extensors of the hip in quiet walking is false. In quiet walking, as I discussed, hip in mid position, main extensor is the hamstring muscle. Answer E, acts as an anti-gravity muscle. It's true. During the act of sitting down from standing position, the chief anti-gravity muscle is the gluteus maximus muscle. Question number 2. Which of the following are true or false regarding the origin of the gluteus maximus muscle? So gluteus maximus muscle origin from the gluteal surface of the pelvis behind the posterior gluteal line, and again from the lumbar fascia, from the lateral mass of the sacrum below the auricular surface, and then again from the sacrotuberous ligament. So we'll see about these answers. Answer A, gluteal surface of the ischium. It's not from the ischium but from the gluteal surface of the ilium. Lumbar fascia is true. Auricular surface of the sacrum. It's true from the sacrum but not from the auricular surface but from the lateral mass below the auricular surface. So the answer is false. Sacrospinous ligament is false. It's from the sacrotuberous ligament. And gluteal tuberosity of femur. It's also false because gluteal tuberosity is where the gluteus maximus muscle, actually the deep fibers of the lower part, inserts. It's not a point of origin but rather a point of insertion. Question number 3. State the bursa in relation to the gluteus maximus muscle. There are 3 bursas located beneath the muscle in 3 locations. One is over the ischial tuberosity, other one is over the greater trochanter, and the third one is over the vastus lateralis muscle. Question 4. Which of the following are true or false regarding the cutaneous innervation to the gluteal region? So we can remember by dividing the gluteal region into 4 because it's easy to remember. We can divide as upper anterior, upper posterior, lower anterior and lower posterior. Upper anterior quadrant, upper anterior part, it's cutaneous innervation by the subcostal nerve from T12 and the iliophypogastric nerve from L1. And then if we talk about the upper posterior, it receives the innervation from the L1, L2, L3 first 3 lumbar nerves as well as the first 3 sacral nerves. And then the lower anterior region is by the lateral cutaneous nerve of the thigh, and lower posterior part by the perforating cutaneous nerve, which is from S2, S3, and the posterior cutaneous nerve of the thigh. It's also from the S2, S3. So this lateral cutaneous nerve part is from the L2. So we'll go through these answers. Answer A, upper lateral part by branches of subcostal nerve. It's true. Then upper lateral part by branches of iliohypogastric nerve. Again is true. Lower anterior by branches of lateral cutaneous nerve of thigh. True. Lower posterior by posterior cutaneous nerve. True. Lower posterior by perforating cutaneous nerve. So all the answers are true. Question number 5. Which of the following is true or false regarding the gluteus maximus muscle? Answer A. Iliotibial tract splits and enclose the muscle. So answer is true. From the anterior border of the muscle and beneath the muscle is where this fascia is thicker, and the other area is the fascia is thin. Coccyx gives origin to the muscle. Yeah, coccyx also give origin to the gluteus maximus muscle. Nerve supply is by inferior gluteal nerve. This is true. The gluteus maximus muscle is the only muscle which this inferior gluteal nerve supplies. Answer D. Blood supply is from profunda femoris artery. This is false. Blood supply to the gluteus maximus muscle is from the superior and inferior gluteal arteries. Answer E. In extremes of hip movements, it's an extensor of hip joint. This is true. I think this answer we discussed in the first question. To exhaust you, I will stop from this question number 5, and the rest of the questions I will continue to discuss from the quiz number 3.